Hey, lovely friend, and welcome to the Botanical Biohacking Podcast. Today we're doing an interview with Dr. Ayla Wolf and Dr. Clayton Shiu. Dr. Ayla Wolf is a doctor of acupuncture and oriental medicine, specializing in neurological disorders, concussions, and traumatic brain injury. She's a faculty member of the Carrick Institute of Clinical Neuroscience and Rehabilitation. There she teaches doctoral courses in neurology as an adjunct faculty of the AOMA, Graduate School of Integrative Medicine, and American College of Traditional Chinese Medicine. She's an international speaker and educator on functional neuroanatomy, neurophysiology, and neurological exam techniques, as well as neurorehabilitation utilizing acupuncture and Chinese medicine. She also teaches advanced courses on the management of patients with concussions and TBI. She's one of the original founders of the Neuroscience Acupuncture Summit. She can be reached at info@acupunctureneurology.com. There, her online courses can also be found at acupunctureneurology.com. Dr. Clayton Shiu was awarded a full-time PhD scholarship by the Chinese government to study at Tianjin First Teaching Hospital under Dr. Shi Xuemin. He's been featured in a new book, Creative Success Now: How Creatives Can Thrive in the 21st Century by Astrid Baumgartner. He's the founder of the Shiu Clinic, where he uses nanopuncture systems and other advanced and innovative modalities to treat stroke and neurological disorders. He's a founder of the Nanopuncture Acupuncture Stroke Rehab Certification course and one of the founders of the Neuroscience Acupuncture Summit.
She and her whole town, which was actually in Concord, Massachusetts, had suffered from nuclear radiation poisoning. That the government was illegally dumping nuclear waste into the ground, and quite a significant amount of people started getting cancer and collapsed lungs in this area. And this woman could not feel her limbs, and parts of her hands had completely atrophied. And her shins had shrunken in. And the first day we did the neuro flush, and she just starts crying hysterically during the first session. And we thought, oh my gosh, okay, maybe that was too intense. But she was crying because she actually, for the first time, felt her nervous system just turn back on. Mm-hmm. So, yeah. And it was shocking a little bit. It was almost, we had to cover her with a space blanket because there was a little bit of a shock to the whole system just activating there. So, but yeah, we find that the neuroflush is such a safe go-to method, basically. And it's kind of nice to know you can kind of whip it out. You know what I mean? As a short go-to thing. So yeah. So yeah.
That's excellent. Can you talk a little bit about yin excess and what some of those concepts may mean neurologically?
Yes. So yin excess, actually yin excess can refer to all of the different type of fluids in your body, whether it's not just blood, but it can be hormonal, and others like substrates, and other just deposits. It could be Lewy bodies. It could be almost anything like that. And what happens is it clogs up the nervous system, mm-hmm. and then it itself starts to build its own acidity and waste. And yin excess is interesting because in traditional Chinese medicine, there's in one sense there's a school of thought of there could be no yin excess because we're always yin deficient, right? So
yeah, I think that's a misunderstanding of the text, but yeah.
Right, exactly. So just to clarify, and I think that's why yin excess is such a great topic, right? Because yin excess, if we finally look at it as types of blood stasises, including even if you had Lyme disease, you had little microorganisms, and those all could be yin excess. And I find that, interesting enough, when I use the botanical biohacking herbs like the Tibetan foot soaks, that's just an amazing yin excess formula to me. Like it just complements the neuroflush as well. Because everyone that we've had who had post chemotherapy, even post radiation therapy, even if they don't believe it, we just tell them, just take your shoes and socks off, go to the next room, soak it for about 15 minutes. And they're just like shocked. They can't believe that all those toxins, just like what Ayla said about the anesthesiology, but those medications creates a yin excess in the body, and interestingly enough, it can collect in the ankles and feet, right? And a lot of your kidney, liver, spleen channels, which has to do with detoxing your body, also flows through there.
When you have yin excess, especially in the brain, and when you have a concussion, you often have some element of damage to the cervical spine. And so the dampness that occurs, and then the dampness that turns into phlegm, can easily become a yin excess in the brain that clouds the Shen, but then it also blocks the Yi from rising. And so the idea of clear yang ascending is a real thing. And so when we have too much yin excess in the upper jiao and in the brain, that clear yang does not rise. And so that the Yi, the intellect, is not able to function as well as it should be able to because of the blockage, not only from blood stasis, not only from actual musculoskeletal trauma to the neck blocking that clear yang, but also now that turbid yin excess that's in the brain. And so that's where not only that neuroflush comes in, but also a lot of these amazing herbs that are aromatic or that can transform dampness and start to get that flow and better, connection between the Yi and the Shen back by clearing out that yin excess and allowing the clear yang to ascend again.
Yeah, and that's what's really special about working with Ayla is that, and everyone's going to see it on the next lecture, it's because Ayla has a way of relating the autonomic nervous system to yin deficiency, basically, and how there's the balance between yin and yang. So she will go in depth with that, including relating it to like the cranial nerves, and it's really cool. It's like it's pretty amazing, basically, that the autonomic nervous system can be broken down this way.
And as well with immune factors and yin and wei. She was just telling me a little bit about that. It's already blowing my mind. I can't wait to listen to it more in detail.
Exactly. It's the autoimmune and the autonomic nervous system, like related from the neural functional point of view. But the fact that we can access it through certain tests and examinations, because what's really cool with that Ayla does that's pretty amazing is she'll make, like if I was Ayla right here, and if I was Ayla's patient right here, and you're seeing me, there'd be like this little X behind me here, like that or something, and she'll have a way of having you focus your Shen on that point, basically, during her examination and during her work, and the person keeps trying to focus on that point with their eye, right? And she'll know if they're using like the abducting orbital muscle, or if they're using like, the third cranial nerve versus the sixth cranial nerve, right? And then she'll pick it out, and then she makes them repeat it like this, right? Until they get dizzy. No, I'm just kidding. But they'll repeat it and they'll repeat it, and then that becomes the treatment, because that, without even needling, like it's just repeating it and focusing the Shen. And if you think about it, she's correcting the Shen and Yi right there too, right?
Mm-hmm. What is feedback you've had from a student in the last year that has really touched you, that you felt really proud to be a part of?
Well, I was so happy when I heard that because Clayton's staff comes to a lot of his trainings, and so his whole staff was at our last training that we did together. And I was just so happy that when he said to me, "Oh my God, my staff loved, the neurological exams," and they like went back to the clinic and they had almost like a competition to see who could come up with the best chart in order to actually track the neurological exams. Yeah. And so, the fact that his staff like jumped on these tests and immediately went back, implemented them, made their own chart, like, chart sheets to be able to chart what they're, testing and what they're seeing. That's what I just absolutely love to hear, is that people have taken the information and then absolutely just run with it.
Yeah. Yeah, we get pretty excited about it, because it just makes us better and more efficient. And so I think for me and in our office, because we're really trying to push innovation and trying to be cutting edge. So it was important to me to bring my whole team to one of Ayla's lecture, because I will come back from a lecture, and it could be any kind of lecture, and then for about a week, all I'm saying is anything from that lecture, and everyone's like, what are you talking about? So because we're like a neuroscience based, pretty innovative office, it was great that we were all on the same page with what Ayla was teaching us and stuff. And also for me, like it's pretty amazing when anyone does the neural flush technique or anything from even just the first workshop, and a patient's like gets pulled off like a surgical list, for example, because now they can swallow food again all of a sudden, and they don't need like a gastric tube put into their through their throat down into their stomach. And it's interesting, lately I've been getting certain phone calls when there's just something terrible happening in the news, and somehow they've heard of our clinic, and once in a while I get asked to like go to some hospital to try to revive someone or something, and we're really not advertising anything. I think it's just the work of and body of what we're doing, and it's spreading a lot, and it's amazing. Like I'm actually very proud of Ayla, because she got invited to speak at Rothenburg this year in Germany. It's one of the biggest international Chinese lecturing conferences, and she's gonna take it far into talking about the gut-brain axis, right, and stuff. So, but yeah, I think for me, because what we do is so important, but the fact that what we're teaching is reproducible, whereas sometimes you go to a lecture and you come back, you're like, oh man, I didn't learn anything. I don't know what to do with it. I don't know where to start. But I can honestly say with our lectures that each time someone takes it, like it definitely changes their clinical practice. Like there's a shift in the spectrum and stuff. So we're really happy that, we're kind of building the new platform that everyone is kind of like loving a lot too. And, and even like I'm giving a Philadelphia lecture soon, and, we have a stem cell medical doctor who wants to attend it. And I'm just like, wow, okay, yeah, come on, you'll have to study hard, or something like, but we're, it's really reaching, or we'll have speech therapists once in a while that want to take our lecture, and that, they're not acupuncturists. Like we're really like, we're staying true to what we're doing in TCM, but we're also bridging and further reaching out into other very respectable professionals who can't ignore the fact that this is working, so yeah.
I had a patient who I lived in Oregon for about 7.5 years, and then I left to go to Texas to get my doctorate, and then I moved back. And so when I lived in Oregon the first time back in about 2007, I had a patient that I was working with for back pain. And so treated her for, a while, and then, she no longer needed to see me. So then I didn't see her for a few years, and then I moved to Texas. Then when I moved back to Oregon, like fast forward to now 2017, 10 years later, she had a car accident, had a bad concussion and a lot of damage to her neck. And she was bringing she and her husband were going to a chiropractic appointment for a chiropractor that happened to be in the office that I had just moved into when I moved back. And she saw my name on the door, and she was like, oh my gosh, I had no idea she moved back to Bend. And she got all excited. And then not only that, she found out that I now specialized in concussions. And so essentially, I see this woman for the first time in 10 years, and I did not recognize her at all. I mean, she was the classic case of like her Shen was so buried. She came in looking, I mean, and she's in her 40s, early 40s. She came in looking like a Parkinson's patient, just with her mouth hanging open, blank stare. She had gained about 80 pounds because she just was so disconnected from her body that she was kind of eating whatever, and none of it was healthy anymore. And she looked and acted like a completely different person who was, for all intents and purposes, just checked out. She had also developed severe depression. She was suicidal. She was in chronic pain. And all of the doctors were telling her there was nothing wrong with her. And this is what I hear over and over and over again from so many of my female patients with head injuries, is that they're highly symptomatic, they're highly depressed, they're in a lot of pain, they know their brains aren't working the way they should be, and yet these doctors are just telling them, oh, you're just depressed, you just need antidepressants, or you just need anti-anxiety meds, there's nothing wrong with you, this had nothing to do with your concussion. And meanwhile, there's no actual neurological exam happening either. And so this was one of those patients where she had absolutely given up hope. That was like she did not ever expect anybody to help her. And, fast forward, I just saw her yesterday. She is happy. She's healthy. She's lost all of that weight she gained. She eats very healthy. She meditates. She, is out like being super active. She basically has her entire life back. Because I took the time to do the neurological exams. I took the time to, in a very functional way, get her brain working again, do a lot of vestibular rehab, help calm down all the neck pain, the chronic headaches, but also really educate her on why she was having the symptoms that she was having. And once she understood what was happening in her body, that alone calmed down so much of her anxiety. And so she's just an absolutely different person now. And she literally said to me yesterday, I was suicidal. I wanted to kill myself. I had no hope. And you saved my life. So it's those moments, those stories that just make, all the effort of learning and practicing to pay off, for sure.
I had a patient. He was about a 12-year-old young Jewish boy out of Brooklyn, and there was this little thing where rheumatic fever was spreading in Brooklyn about 2 years ago, and he had gotten it, and unfortunately when he got it, he was misdiagnosed, and the fever had spread, and the infection had spread to his heart, so his heart swelled up, and he got endocarditis. And then they gave him steroids. It worked about a day, and then his body like crashed. And he basically, at that point, it evolved into what's called chorea dyskinesia. So he started walking around. He couldn't talk. He couldn't say anything coherent. He couldn't walk down the hallway without looking like a 90-year-old person, and didn't have any balance. He would have failed every test that we would throw at him, And so we started the neuro flush again. And we started needling, and every needle was like a huge torture. We would have to put this bucket underneath his face girdle for all the tears and coming out every time. I thought I was gonna lose my lease in the office because he would howl and cry, But then about 4 treatments later, he started to walk a little different. We started seeing a little change. And about 14 treatments later, he started speaking better too, and we kept flushing and flushing. And it was every needle was like a hostage negotiation too. I'd be like, well, you're going to have to give me something, kid. Give me, I need PC6 today, and he'll be like, well, then you can't needle my leg. And I'm like, fine, then you just won't walk, but I need you to talk, or
Okay.
something like that.
And I need to explain this a little bit. So regular PC6, you may feel a little bit of an electric twinge or a dull sensation. The first time that you did PC6 on me, I felt like sparks were shooting out of my fingertips. So just for those listening, it's not the typical acupuncture that you may have experienced anywhere, and it's well worth feeling for yourself. So I can kind of sympathize with this kid not wanting to have a whole body visceral electric sensation as though he was hooked up to a giant battery, because that's
this
kind of
is
the
true.
puncture.
Yeah, and he was probably in the most sensitive state you could think of, and that's you're right. I'll give you that one. So, but interestingly enough, and I didn't know this, but the mother later, about like another 5 sessions later, and we were looking at him, and I don't know if you ever remember the grip machine that we would use sometimes. He couldn't even hold that up when we first met. He would try to hold it and his arm would go like this, And then he started getting stronger, right? And finally his mother took him back to the cardiologist, and he ran and scanned the heart again, and the swelling was gone, actually. So it actually reduced. We didn't use any herbs because she was so freaked out by anything right now because of the steroids. But his whole situation had reversed. And the only time, at this point when he comes in, is if we think he has a fever, but we're going to change the treatment pattern now so that we're treating more on the exterior level. So that was,
Will he be able to dance at his bar mitzvah?
Right, yeah. I think I'm invited, So, I think I get to recite something from the, from the Torah. So, and then, so taking that case, that was probably about last year we did that. And I can say that maybe 4 years ago, I don't know if I would have been that confident thinking I would risk trying to take this on, because this kid could die basically. They were ready to give him IgG, But fast forwarding to this year, and this is probably why I haven't been on Facebook as much and some of the media, because we've just been so caught up with stuff and working on stuff with Ayla. But we used a similar technique. We had several ALS patients who couldn't breathe well, who couldn't hold their neck up, and this one small Asian woman had lost about 40 pounds. And then when we started doing the neuroflush again, along with treating the brain stem and her autonomic nervous system, interestingly enough, she started gaining weight. And she actually gained 7 pounds since we started in the last 2 months. Before that, it was just like that. And then when she went to her ENT and the neurologist, they found that her respiratory had stopped breaking down, that wherever it's at, it just plateaued, And again, we go in there, we are being consistent, we're making our observations, we do adjust certain needles, but it's really about refinement and trying to clearly, profoundly understand certain things that you're trying to do and make the right adjustments when you can understand it correctly, and that's why it's exciting sometimes for me, even if it's a new patient, but when Ayla and I can both look at them at the same time, it's exciting to see what she sees while I'm looking at it too, and vice versa, but also that we would stick to our guns and be I think it's this, or I'll try that, knowing that we're practicing it every day, So even my staff, I can say something okay, the right arm, we're going to do it this way and for this result. And they know exactly what to do, which points. But then later we always say, okay, what did you feel? What did the patient tell you? What did you feel in the needle too? Because your needle should talk to you basically. And if you're not talking to your needle, you're needling blind, like that, like that. So, but I think that's, with all 3 of our stories, there's that resonating theme of you got to know your shit and you got to know what you're doing, but you also have that can polish and grow, And it's just like when I talk to you, Andrew, about certain cases, and you'll tell me something about like Huang Lian or Huang Bai, I'll be like, oh, fuck, shit. Well, I didn't know that. I didn't realize that. Like, you know, and I'll put it in. I'll be like, oh my gosh, that worked. Like, silly me, you know, or something. But to you, it was like so clear. It's like pulling that thread to make something work, you know. So, but yeah, those are recently the most recent cases that we've found that even surprised us. And we were, at the same time, we were like, well, we're just going to keep on doing this and not think about 7 pounds and hope it turns into 10 pounds and, you know, and then ruminate later, like what improved or not. I mean, for all I know, the ALS patient improved because we have ALS cheat sheets in our computers. I don't know. Like, it could just be that way. So,
Dr. Wolf, where do you see the objective diagnostics that you're bringing to the table having an effect on the Chinese medicine profession as a whole within the next few years?
I like to remind people of what has already happened in our profession. In, let's say, the orthopedic realm, you know, you have somebody like Matt Callison who's developed this amazing sports medicine program that really does emphasize orthopedic testing. You know, you have someone comes in that says, my shoulder hurts. We should know how to do orthopedic tests on the shoulder to understand, you know, is there a certain muscle that's been torn? Is there what's going on with the joint? What's their range of motion? I mean, we should know what someone's range of motion is before we treat them and then after we treat them. And so it makes perfect sense that in our medicine, we should be taught orthopedic examination skills and put those to use on a daily basis. And same thing with people specializing in fertility. You know, those people are spending a lot of time learning how to read lab tests and interpret lab tests and understand the, you know, orchestration of hormones and endocrine function in the body and how that relates to, you know, what we're doing with herbs and acupuncture and looking at changes and differences in those lab tests. In regards to the patient who's trying to get pregnant. So it's the same exact thing with neurology. You know, the more that I incorporate neurological exams into my practice, the more I realize how irresponsible it is to treat somebody and not do a neurological exam. And so if anybody who treats somebody with a concussion, a brain injury, a stroke, any kind of neurological disorder really should have an understanding of how to assess that patient's brain and their nervous system and understand how their treatment is having an effect on that system. And so that's, you know, what I'm hoping to bring to our profession is the educational platform to be able to offer those types of trainings to people that know that they want to specialize in neurological disorders.
That's beautiful. I think anybody who's doing diagnosis of any kind will come to a place of ambiguity with a patient. The only exception I've seen to this are experts who don't actually treat patients. Then they have an answer for everything. But whenever you're really treating patients, you'll come to a place of ambiguity. And intel from anywhere, you want the best intel to make the best decisions, especially when somebody may have come to you on their last legs. They may not have energy to try 2 more methods. Maybe this is the last method they can try. And if you're adjusting them to the left, you may not get a chance to go, oops, I should have adjusted you a little bit more to the right. So I really appreciate what you guys are bringing, because you're bringing both advanced diagnostics from a traditional and modern standpoint. And I see that as, I feel very excited about that, because I know for myself, there's always a point where you come to this place of ambiguity, and that's when I don't sleep as well as I should. You know, you kind of lay awake at night thinking, God, there's this 20% chance that I might be wrong with that. And being able to rule that out is such a tremendous gift. So I'm really looking forward to learning from both of you more than I already have. And I'm very appreciative of what you guys have taught me so far.
Thank you.
Yes, thank you. And I'm excited to sign up for your recent class you just posted.
Oh, the microbiome mastery. Yeah, I'm working with some people in China, and so we're kind of doing this as a collaborative effort. So.
Awesome.
Wow, that's exciting. It's exciting.
That's fun. So do you guys have anything else you'd like to add?
Yeah, I think
Upcoming
in
parties?
in addition to our March autonomic nervous system cranial nerve lecture, in April we're two of the founders of the Neuroscience Acupuncture Summit, and that's going to be in Orlando. What are the dates on that, Ayla?
Well, it literally is going to be a party because it's on my birthday.
Oh, it is. Oh,
yeah. It's April 3rd to the 5th, and my birthday is on the 5th.
Wow. Yeah, and that's going to be it's probably going to be one of the most talented lineup of pioneers in 3 days that are coming to celebrate Ayla's birthday.
That's really what it's all about.
Yeah. The founders, we had done lectures last year, which we're now doing new lectures, and we're each approaching things on the cutting edge of neuroscience. But what we did went so well that we've attracted even non-acupuncture but famous pioneers such as Ayla's mentor, Dr. Fred Carrick. So he's actually our keynote speaker, which we're so excited about. So it's amazing he's going to be a part of it. And we also have Matt Callison coming to give a sports lecture in relation to nerve entrapments. And Andy Rosenfarb, Dr. Rosenfarb, he'll be doing ophthalmology, acupuncture as well. And Dr. Michael Cordino, he's going to be doing the back shu and his method with neuropuncture. So, and then I'm actually going to be speaking about neuroscience through the ages and seeing how it's played a role in shaping acupuncture and in some of its developments, all the way up to stem cell and photobiomodulation. So that's my topic. But I mean, it's an incredible lineup, and we're pretty excited about it. It's really like a gathering of like-minded people. We're going to have amazing vendors even there who are going to bring in just super advanced, innovative products, including certain kind of like, photobiomodulation machines, region pods, and also like different botanicals, and just anything that's related to the autoimmune, the nervous system. This is going to be like a huge event. So, yeah.
Oh, beautiful. Thank you so much for coming on.
Yeah.
Thank you for having us.
Yeah, thanks for inviting us.
Thank you for listening to the Botanical Biohacking Podcast. I'm your host, Dr. Andrew Miles.